Greater Good Radio. Connect, learn, heal, and grow.
My wife is level 2,
Okay.
and she TAs level 1 and 2, and I think she's
is
going to
she?
do level 3 pretty soon.
I should have talked to her
Yeah.
on that. So is your wife a therapist then?
No, she's been an intensive care doctor most of her life, integrative doctor, but she started to do ketamine-assisted therapy in a way that would take her background of being a dosing geek of a system.
She's doing ketamine-assisted therapy and then her other practice, or she's mainly doing that and like doing functional medicine or something?
So she's got both. She's got internal and integrative practice called coldspringmd.com. And she also has precisionbreakthroughmedicine.com, which is specifically ketamine-assisted therapy.
Okay. So is that through IV or intramuscular? Or?
So she's a total dosing geek. And so she does it through intramuscular. And she has a whole protocol where everyone else does it by weight for the most part. And a lot of times they do it where you have kind of like a trip to the moon. And what she does is she really tunes into the nervous system, and she spends up to 6 months developing trust, not just with the person, but with the parts.
Oh, wow.
And instead of using ketamine to pretty much put the parts to sleep and to then do work that's deeper.
Yeah. The one thing you got to watch out about that though is if you do it and weren't willing initially, the backlash after could be bad.
Yeah. Have you come across that or?
Yeah. I mean, on myself. Yeah.
No, you're not alone.
Oh, yeah.
In fact, there's a lot of times that people come to her who've done ketamine with other places and things like IFS work, and there's huge backlash.
Yeah, you got to be careful on the backlash.
And there are protocols to reduce, harm reduce, where it's like, talk to your parts beforehand and get permission, but it's one of those things where it isn't a perfect approach. And so she actually will do several shots, but very small amount each time.
Okay.
As she's tuning into your psychology.
You mean in the preliminary work?
No, in the dosing.
Oh, during the dosing. Okay.
Yeah. And so she keeps you at a state. Now, this is super technical.
So you're not dropping in the K-hole?
What's that?
You're not dropping K-hole?
Her goal is that after the session, you're disappointed because you didn't have some peak experience, most likely.
Oh, that's interesting. I'll tell you why. Can I go back a little bit? So parts, right? So parts of us, we all have parts, right? Part of me says, I'm enjoying being here today. Another part of me says I should be managing my renovation. Another part says, hey, you should actually be making money on stuff and so on. Another one saying, hey, maybe you should visit your child, right? Yeah. So all of us have these kind of parts. They have their own personalities. They have their own roles, right? Some are protective in nature. Some are wounded in nature. And then we have our self, which is like our soul, our spirit, what we come in with. And that's kind of the compilation of the system. In like ketamine-assisted therapy or psychotherapy, it's interesting. You can keep somebody into that range where they're physically can feel safe enough to go to the wounds and actually process it. I think about it like surgery.
Yeah,
right?
It's complete surgery when you do it right.
Surgery, yes.
The standard of care now is a pretty big dose, 1 or 2, kind of, like doing it and then kind of a bumper, whatever you call it.
You talking about for ketamine?
Yeah.
Okay.
And it's a peak experience.
Yeah.
And what she does, and I don't want to speak for her, but my impression of it is she brings people just to that edge where they have autonomy to decide to go further or to stay back and be kind of more in like the protected, sober, what have you. And she stays there for like an hour. Because she does, several micro
shots. That's a while then. Yeah, because normally ketamine is kind of quick.
Yeah.
Yeah.
And so it's an experience that can be very confronting. You can be in the most critical parts. And she really emphasizes that, like, without therapy with it, you're really robbing yourself.
I feel that way too, because I kind of feel like for the psychedelics in general, almost like an anesthesia to an extent, right? Like if you're going to a hip surgery, you could do it with no anesthesia. It would suck super bad and it would be painful so bad, but you could do it, you know what I mean? But if you don't do the surgery while you're under, then you still have a hip problem.
Yeah.
Right? So the interesting thing when I noticed that on like ketamine kind of experience is that depending on the administration and how fast it onsets, right? Like the lozenges that are done too, they take a while, like, 10, 15, 20 minutes, sometimes like that, to kind of kick in, versus an intramuscular shot or an IV drip, which is pretty much instantaneous and you can kind of monitor it, right? The thing is that there's that initial kind of range where it's before you're completely dropped into, the K-hole or gone, where it's like you're gone, that a lot of that kind of conscious work can be done, where unconscious can be brought conscious, and you can do it because it's not so scary anymore with the right environment and the right practitioner.
Exactly. And that's why she doesn't work with people without them going to therapy.
Okay.
Most of them will go to a PARTS, IFS trained therapist. She works with them for up to 6 months.
If you resonate with Greater Good Radio, please join our community at www.greatergoodradio.com, where you can get access to exclusive content and offerings. Hope to see you soon.